Swarna Bhavatu Swarnam Bhunaktu. Sorry, I'm forgetting the prayer.
Sahaviryam Karavavahay
Karvavahe Tejasvinavaditamastu
Tamastu Ma Vidvishavahay Om
Shanti
Shanti.
Shanti Shanti. Slowly open your eyes and relax. So can I get the sharing rights?
Yeah, ma'am.
So good morning, good afternoon, everyone. My name is Priya Ahuja, and I am an educator by profession. I have been in teaching line since last 15 years. I have been doing yoga since last 7, 8 years, and I'm also a trained teacher from Yog Vidya Niketan. And I've been practicing yoga and taking yoga session since last 2 years, batch in the evening. In my old building, I have a group of 25 to 30 students. The journey has just begun for yoga. I want to go way further in yoga and uh, be the cause of helping people as much as I can and help them with their health and with their well-being. So that is my goal of life now. This is what I'm looking at, and I'm thankful to Devang sir and ma'am that they have given me a chance to join this session and be part of it. And today I will be presenting my the presentation, which will be on dental surgeons, the health issues, their lifestyle, and what precautions and care they should take in terms of yoga, pranayam, bandh, and mudras. So, looking at cooperation from all of you, there is a small quiz at the end of the presentation, and I'll request you all to bear with me here to the presentation and actively participate with the quiz. Thank you very much. Just give me a minute. I'm sharing the presentation with you all. So here we start with the presentation. It is talking about the well-being, a holistic approach for dental surgeons. So what are we going to look at? We're looking at the job summary of the dental surgeons. What are their key responsibilities? What qualifications they have once they become dental surgeons? What working conditions they are into when they are surgeons? Also, we are looking at majorly what health issues they face while they are on their professional field. And as a yoga therapist, what can we suggest them to follow in their routine? The asanas, pranayams, shuddhi kriyas, meditations. And also at the end, I have added an interview and a routine which is suggested for the therapist. So we are looking at their role summary. So what are these dental surgeons actually looking at? So they basically look into the routine extraction. They also look into the surgeries of the patient. They try and give all the comforts to the patient when they are as professionals, as surgeons. So the main thing is, first they diagnose and plan the treatment of the patients. So they look whether it is an implant, or whether there is some facial trauma because of the accidents, or they have some oral cancers. So first they look into what are the issues of these patients, and then they take a call how to go further. So they plan accordingly. So now the surgical procedures are quite lengthy. They look into, the tooth extraction, if that is required, the wisdom tooth. A lot of times, most of the people face this issue of wisdom tooth. They look into the facial reconstruction, how to maintain, and sometimes there are accidents happening. So if there are deformities in their face, or their tooth has broken, so they look into all these surgeries. Also, they do the treatment of oral infections and traumas. So the dental surgeons, this is their surgical procedures, what they follow. So before that, they also have to look into anesthesia, how to give them, what precautions to take. And they collaborate with a lot of other dental surgeons who are the orthodontists, and also people who are prosthodontists, and people who are general dentists. So they work in collaboration with all these people when they are doing surgeries. Now, what are the skills and the qualifications we are looking at? So, of course, they need to be having an MBBS or a doctor degree in dental medicine. And they also have internships where they have to go through those. They have to have the state license required as surgeons. So after they complete their regular MBBS, they get into the surgery, they get into the surgery thing, and they do the surgery, they study for the surgery, and then they become surgeons. So they not only require the degree, they also require a lot of skills, interpersonal skills, how to make the decisions, and because the patient's life is at stake with them. So they have to have all those skills in place when they are as dental surgeons. Now, when we are looking at dental surgeons, we look at them, where are they working? How is their work environment? So usually you'll see the surgeons working either in clinical setting, where in the hospitals or surgical centers. They are also at times at, the military, the places where there are military hospitals. So those people need. So over there you will see them. You will also see them, at different clinics where they start their own clinics and they work. And there are a lot of those centers as NGOs also, where dental surgeons are working. They collaborate over there also. Now, as a dental surgeon, they have, a very high demand on job. So they have to stand for long hours. They have to stand in awkward positions for long hours. And they also uh, they also need to be fit and fine when they are do. You can hear me, right, everyone?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, okay. Okay.
Yes.
What are the skills required when we are looking at these dental surgeons? So they, of course, need very good communication skills. The important thing we look into is that they should have the empathy and the compassion for the patients. Every doctor needs to have that. And whether it's a surgeon, whether it is a regular doctor, they need to team collaborate, and they need to maintain the calmness with the patient when the patient is there. They also have to know how to deal with patients when they are not comfortable, or when they are uneasy, or when they have anxiety. And as a surgeons, they also need to know and maintain their teams. So different teams, different people who are working with them, they need to know that also. Okay. Moving further, the important part is what we are looking at. What are their health issues the dental surgeons are facing? So they majorly face musculoskeletal problems. They also face sometimes vision strains, and they also face issues with their respiration. Now, how? So when they're standing for a very long time, they do get back pains, neck pains, and shoulder pains, especially in the government hospitals or in the hospitals where, in the urban area, rural area, where there is a lot of crowd. So they have continuously on duty. Many a times it's just 8 hours duty, but they are working overtime because there is shortage of doctors. And many a times they're looking into the light when they're doing this surgery. So that may give them eye strain, that may give them fatigue, and also headaches. So these are the major health issues. They also sometimes face respiratory issues, and sometimes when they are doing the surgeries, most of the time they do take care of wearing the gloves and not getting infection, wearing the mask and everything. But at times there are items which are used, the tools which are used, they may cause some infection to them. So we have to take care of all those things. And also, how can we as yoga therapists suggest them what changes to be done? At times, they also face hearing problems, and they also, because they have a routine which is very tough, they also get mental health issues at times. Majorly, their hand and wrist is a issue because they are dealing with the tools and using those tools for longer duration in the mouth of the patients. Now, what are we going to look at is majorly the asanas, what we as yoga therapists can suggest them, and how can they benefit these asanas to these dental surgeons. So first we are looking at the cat and cow pose, which is also called as Majarasan. So how does Majarasan help? So Majarasan basically helps them when they have been standing for very long. It helps them to help their flexibility of the spine becomes better, and also it reduces their back and their health issues where this flexibility of the spine becomes better. Now, every pose when has to be done, it should be either done with the guidance of some people, or at least the person who's doing it should know what are the contraindications of the asanas they are doing. So when we are looking at cat and cow pose, who should not do cat and cow pose? So the people, especially if they are pregnant or they have, major surgeries done lately, or they have wrist and shoulder injuries or severe back pains, they should avoid cat and cow pose. Now, the next thing is we are looking at child pose, uh, asan, which actually gives you a good stretch. It also relieves the tension of your lower back. And people who should not do are people with knee injuries, people with ankle injuries, people who have done any recent surgeries, or and also females who are pregnant. They should avoid doing child pose. Now, downward facing dog. It also gives a full stretch to your body, shoulders, and hamstring muscles. And we should, when we are doing these, should start with 2 or 3 rounds. You should follow the breathing pattern, but you can increase as and when, depending on your practices of hours. So now, people who should not do downward dog are the people who have, the back issues, the wrist issues, shoulder issues. They should not do downward facing dog asana. Now, the next asana is the thread needle pose. And this relieves your tension in your shoulders and upper back, and it gives you a stretch in your thoracic spine. So when you are doing these asanas, you have to balance it out that you're doing on the both the sides. On the asanas which have left and the right, they have to be done on the both the sides. Now, who should not do this thread and needle pose? People who have recent surgeries, especially in back, shoulder, or knee, they should not do. Of course, people who have shoulder injuries and people who are pregnant, and those people should avoid these asanas. Now, looking further, we are also looking into Tadasana. So that Tadasana actually improves your balances, your alignment. It gives you a very good posture. It reduces the strain caused when you're standing for a very long time. So it reduces the strain caused. So when we are looking at there are different ways where people follow these asanas for the duration they follow these asanas. So you can increase your time according to the practices you are doing. And you have to follow the tips of the asana every time when you are doing it. Like, for Tadasana, you have to keep the eyes, your gaze in one position only so that you can balance the asana. And people who shouldn't do these are people who have severe back issues, or people who've had any ankle or foot injury, or any uh, surgeries recently. Only those people should avoid this. Now, when we are looking at these are the some of the asanas the dental surgeon should follow. So depending on his routine, he can pick up few on daily basis and do. So asanas like chair asan, it gives a very good balance to your, strengthens your leg and your core, and it gives you helps you in focus also when you are working for long hours. And the next one is Bhujangasana. So we all know how to go into these asanas and how long to stay. But initially, when they start, they should do it for few counts, say 20 counts or 15 counts, and later they can increase the counts of these asanas. But they have to be very careful. Who all people have to not do, they should know the contraindications of these asanas, and then they should follow these asanas. Now, when we are talking about the dental surgeons continuously looking at the light and they getting a lot of vision stains, so what can they do? So they can do simple exercises, and where rolling of their eyes, closing their eyes tightly and opening, and taking their eyeballs to left and right, up and down. They can do these simple exercises to improve their eye vision, keeping their eyes more healthy. A very good, a very good thing they can do is palming, which is rubbing of their hands together and cupping it on your eyes, the cupping your palms on your eyes and keeping it closed for some time and holding it for some time. So that helps them for improving their eye vision. Now they are dealing with a lot of tools. They are using those lot of tools while they are doing the surgery. So their wrist needs to be taken care of. So their wrist gets a lot of strain. So what should they do? They should do the wrist stretching of their wrist, using their fingers in front and back, stretching their palms in front and back, stretching their hands and opening their fingers wide and closing their fist. So they should do these on regular basis. Also, these dental surgeons, for their mental health and for their respiratory issues, they should look into alternate nostril breathing, which is Nari Shodhan also. It is a pranayama. And they can start with 3 counts or 4 counts and then increase this, of course, under the guidance of some expert. They can also do Brahmani, which actually relaxes them, reduces their stress and anxiety, and also help them in their in case if they have no regular some basic respiratory issues. So these both the pranayams will help them. Now, we have also looked into these asanas of Bhujang asana and Rakshasana, which they should follow. For mental health, they should also do, if they are able to do it on regular basis, they should follow Vipreet Karni and also Shavasana. So that will actually reduce their anxiety, their stress, and it will also improve their blood circulation. And Shavasana will reduce overall stress, which is also called as corpus, and some people also call it as Chaitanya Asana. Now, when we are talking about mudras, these mudras can be done anywhere, anytime, even if they're holding it for some time when they have taken some break. It will help them, especially reducing their strength, stress, and anxiety. So, the first mudra is Jana Mudra. So, this mudra helps in concentration and it helps them in calming their mind. The next one is Prana Mudra. It helps actually stimulates their root chakra and helps to increase their physical and mental stamina. So it should be done, say, for maybe half a minute or a minute. Hold it in that position and be in that position. Now, when we are looking into these Shuddhi Kriyas, so they actually rejuvenate you. You can start with Kapalbhati Kriya, which actually helps to clear your respiratory system and it boosts your energy. You can also do Jal Niti. Under the guidance of somebody, you can train yourself. The doctors, the dental surgeons can take some sessions. They can train themselves, and Jal Niti will help them to clear their nasal passage. And if they are facing any respiratory issues, it will help them because they are exposed to a lot of chemicals and dust. Even when they are, grilling the teeth inside, the powder of that is also coming. Though they are using the mask and everything, but to some extent, somewhere down the line, they feel this problem. They can also do Kunjan Kriya, which is also called Vaman, which is to detoxify their digestive system and reduce their stress. And if in case they have any digestive issues, Vaman can help them. As we also mentioned earlier, that they have strain into the eyes, so they can do Tratak, which is focusing on a candle, like gazing meditation, which we have also done in our class. So these people under the guidance can do candle meditation and Tratak, where they are looking at one point, which will reduce their eye strain and it will enhance their mental clarity. Now, a very important part, which I think everyone from a common man to any professional should follow, is meditation and relaxation practices. So, the dental surgeon can follow different kinds of meditation. They can do Yog Nidra, they can do mindful meditation, which will help them before they are going for a surgery, which will help them also to sleep well at night, and which will help them to uh, coordinate with their patients in a better way, which will help them to keep calm and relax throughout. So there are a lot of different techniques which they can follow for relaxation and for meditation. Now, here is a short interview which I took from with Miss Dr. Manisha Mehta. She is a bachelor's in dental surgery. She has a dental clinic at Matunga and at Worli, and she has an experience of 19 years. So I had asked her a few questions. Typically, what is her working day? Because she has a private clinic, her working day is very different from people who are working in hospitals. So she is able to take care of her health as a dental surgeon. So she do work out. She has a healthy breakfast. So I had asked her questions which related to her work-life balance and her professional life. How does she balance? So she said she has enough time to manage her workouts and her everything in the mornings, and she's able to to also take care of her professional life. And she said she is very much she takes time management skill as which is very important, where to stay physically healthy and maintaining her health. So she does yoga practice also thrice a week, and she also does follow the gym thrice a week. And she is also a sport lover, so at times she tries and plays some badminton or throw ball or pickleball depending on her schedule. So I asked her, what kind of food does she follow, and how does she ensure that everyone is getting, the best care. So how do you keep yourself healthy? So she gave her schedule overall. She mentioned that she eats healthy food. She doesn't eat packet foods as possible. Of course, no alcohol and no smoking and everything. Also, she hasn't really faced any health challenges in past because she's been taking care of her health, and she has been able to balance her family and her professional life. She usually makes her meals which are healthy. She cooks her meal on her own, and she doesn't follow. She believes in not taking anything further for the next day. She doesn't eat the next day food. So she'll try and finish the food at in night, and she tries also and follow the having her meals before the sunset. And I also asked her that, how does the nutrition helps to keep a healthy lifestyle. So she replied all based on her routines of her food, her exercise, and also her meditation, and how does she relax herself. And she also goes for walks to take a break when sometimes she feels the dental procedure has extended for a very long time. So she also does regular workouts and strength training. Even if the gym is closed, she does it at home. Now, these are some of the suggestions which a dental surgeon should follow. Like morning, they can begin with Tadasana or Vrakshasan to when they wake up in the morning to improve the balance. They can start with Kapalbhati Kriya. Also, they can have do some mudras in the morning for better relaxation and to activate their digestion. So now during the break, depending on their schedule, they can follow Anulom Vilom for some time. They can also sit in Jana Mudra. In case if they have a place where they can do the Gomukh Asan or relax their shoulders, roll their shoulders, they can also do that during the break in the daytime. Now, in the evening, if in case they get a chance and they are really, bothered about their health and how should they take it, because they may not get time during the day or at night, they're too tired to go for, do some stretches or so they can incorporate that during the day in their routine. So they can do Bhujang Asan to stretch their back. They can also practice Shitali Pranayam to cool down their body. And at in the evenings, or if they have come back home early, they can also follow Shavasana and Yogic Nidra for relaxation, deep relaxation. Now, we'll also suggest that as dental surgeons, they can practice Jalniti for few times so that their respiratory health issues, they don't face any respiratory health issues. For their eye stain, they can do Tratak, and very important, they maintain a good posture, and these practices will help them to reduce their physical and mental stress and enhance their overall well-being, which will be leading to more balance and a healthier life. Now, in short, I can only say that they need to maintain a healthy workforce. They need to have a high quality life by maintaining good health, work-life balance, uh, professional support, and also enhance themselves maybe by doing their hobbies, by doing something which relaxes them, keeps them happy, so that they can focus and they can thrive professionally and personally. So now I will be asking you the quiz. Are you all ready for the quiz? There are short questions on only 4 questions. Whoever knows the answer can unmute themselves and say, the first question is, which asana is best for relieving back pain for dental surgeons? Anyone would like to answer?
Cat
Jia,
and cow.
Tejas?
Cat and cow pose. Cat and cow.
Yes, cat and cow pose. Thank you very much. That's correct. Okay, what is the primary benefit of Kapalbhati Kriya? We all are looking into, as we are yoga therapists, we all must be knowing what are the benefits of Kapalbhati Kriya. So, any one of you, Tejal, would you like to answer? What is the primary benefit of Kapalbhati Kriya?
Detox the body and clear the mind.
Yes, it detoxifies the body and it clears the mind. So there are a lot of benefits, but we are looking into the specific primary benefit. Okay, the next one is, which mudra is recommended for relaxation and stress relief? Jia, would you
Gyan.
like to answer?
Gyan mudra. Gyan mudra.
Pran mudra. Okay. The last one, what is the recommended breathing technique for mental clarity and stress reduction? Any one of you?
Alternate nostril breathing.
Yes, alternate nostril breathing. That's correct. You were right, and I'm thankful to you all for attending the session attentively. Thank you very much.
Thank you, ma'am.
Thank you. Very